Continues to record alarming numbers of COVID-19 cases every day. The country has reported 273,810 fresh COVID-19 cases in the last 24 hours. India has registered the biggest spike ever yet again. The latest spike has taken India's COVID caseload past 15 million. India continues to be the second worst affected country due to COVID-19 after the United States. 1,619 people have lost their lives in the last 24 hours. India's total death toll has crossed 178,000 mark. Indian Prime Minister Narendra Modi is currently chairing a high-level meeting regarding the worsening COVID-19 situation in the country. The national capital, Delhi, will go under complete lockdown for 1 week. The decision comes as Delhi registers the highest number of cases ever in one day, that is 25,462. Delhi has a positivity rate of 30%. This means every third person being tested is positive for COVID-19. On the national level, 1 in 6 people is testing positive for COVID-19. The second wave of COVID infections has crippled India's health infrastructure like never before. Delhi Chief Minister Arvind Kejriwal has urged the central government to provide more hospital beds. On Sunday, less than 100 critical care beds were available in the city of more than 20 million people. The city is also running out of oxygen cylinders and medicine required to treat COVID patients. Kumbh festivities come to an end after Prime Minister Narendra Modi said that the festival should be symbolic. Delhi authorities have said that Sirs returning will have to quarantine for 2 weeks. 3,700 people have tested positive in the city of Haridwar and amid the Kumbh festivities. RT-PCR tests in India are failing to detect whether a person is infected or not. Let's try and understand why many people are receiving false negative COVID reports. The virus it was designed to detect has now changed its behavior. The mutated strain does not colonize in nasal or throat cavity. People are collecting swabs are also not very well trained. There is an improper and delayed transport of samples to testing facilities. How is the new strain of the virus different from the previous one? Well, the new variant has a so-called double mutation. These mutations allow virus to gain entry more easily and it multiplies much faster. The mutation might make it more difficult for the immune system to recognize the virus due to its different characteristics. It has also been found that the new variant has ability to surpass the immune system and is highly resistant to antibodies. How is the new strain, as I mentioned, different from the previous one? Those are the few things that we mentioned that makes it very different from the previous strain that had engulfed the entire country. Okay.